Now, I'm going to demonstrate and go through an entire pre-talk with a client as if she had just walked in the door, I've never met her before, and we're going to be going into, from the pre-talk, a complete session. As I've said in other parts of the DVD, I think pre-talk is the most important component of a hypnosis session. Now, for teaching purposes, this pre-talk is going to be relatively short. If Paula were an actual client, I would certainly expand on some of these things and address probably some unique issues. Paula, in this scenario, is going to role play that she's coming to see me simply to learn some stress management techniques and some anxiety management techniques. Now, this isn't uncommon. I actually had a few weeks ago a lady who's an oncologist. She's about 55, and she made an appointment with me simply to help her manage her stress more effectively. And so I saw her for 3 sessions and taught her the principles of self-hypnosis, and those things really were effective for her. And so even though the issue of stress management seems sort of simple or generic, it can really...
Everyone has stress.
Yeah, it can really make a big difference in a person's overall quality of life. And so I'm going to go through this pre-talk again from the very beginning. Paula's actually going to go out there, and she's going to come in the door. I'm going to greet her, and we'll come onto the camera here, and we'll get right into the pre-talk. So with that, let's demonstrate a pre-talk. Now, before any client comes in the office, I'm usually sitting at my desk, ready to greet them.
Hello.
Oh, hi. How are you? I'm Richard.
I'm Paula.
Here, great. Here, come on in. Welcome. Have a seat. I see your purse is already here. It beat you to the session, so that's fantastic. Well, I'm really glad to see you. Stephanie told me that you would be coming here today, and I guess, how did you hear about us?
Well, I actually have a friend who was a client of yours, and they came in for smoking cessation, and it worked, and they quit smoking, and everything was great. But a lot of what was real helpful for her was just how to manage stress in, I guess if you smoke, you're stressed out and you want to smoke. And so that was very helpful, and my life is really stressful. And so I thought maybe I could learn some stress management issues that would help in a lot of different areas.
Yeah, well, whenever I see somebody for smoking cessation, one of their big fears is, how am I going to handle stress? Mm-hmm. So I spend a lot of time teaching them some stress management ideas, and I meet with a lot of folks here to help them deal with some of the stress that they're experiencing. So what kind of stress? Is there something in particular that's bothering you, or the way you handle stress, or specific scenarios?
There's just stress everywhere in my life. I have children, they're stressful. I have
kids too, so
you get that, they're stressful. Work is stressful, relationships are stressful, everywhere. There's always something not going okay, and, it can be miserable, it can be depressing, it can be, I get anxious, I worry, have I taken care of everything? Am I missing something? Did I forget to do that? And I just need some other way to manage things.
Sure. How in the past have you managed stress, or have you just automatically been able to take care of it?
Well, you try, and then sometimes you eat a box of Twinkies, and then sometimes you have a couple drinks, and or try to go running, or try to whatever, but nothing consistent, I guess, is the problem.
Sure. And, one of the things that makes hypnosis effective is that I can teach you some strategies that can help you be consistent in the way that you manage stress. And that's really one of the keys. Being able to each morning start with the same framework of feeling hopeful. Mm-hmm. Each day, at the end of the day, being able to feel like you can close off the stress of the day so you can get the rest that you need. And those are a lot of the stress management ideas that I try to teach people, that people have found to be really pretty useful. Mm-hmm. So, your friend, how long ago did I see her?
Maybe 5 or 6 months.
5 or 6 months? Okay. Mm-hmm. She's still not smoking?
Still not smoking.
Great. Well, that's fantastic. Mm-hmm. Do you have any experience with hypnosis? Have you ever been hypnotized before? Have you seen a stage hypnosis show? Or?
I've seen a stage hypnosis show, and I've just heard what my friend said, but I don't really know anything about it.
Yeah. Most people come in here, and they don't know anything about hypnosis. And, hypnosis is a normal process, a natural process. I'm sure your friend told you it's not like Hollywood at all.
Right. She said it's like a whole lot of nothing, and I'm trying to figure out what that means.
Yeah, a whole lot of nothing where you learned a lot.
Right.
Have you ever been to a college class or even a high school class where you space out and you're not really listening to the teacher, but at the end of the semester, somehow you pass the exam anyway?
Right.
Because you got the knowledge when you were in that deep state of relaxation, daydreaming in class. So, I'm glad that your friend benefited from coming here today, and the things that I'm going to be able to teach you are going to be really useful as well. Most of the time when I meet people, I usually meet with them 1 to 3 sessions. And 3 sessions really gives me an opportunity to kind of follow your progress and see how you're doing in implementing these ideas and see if we need to adjust these. Now, I know you talked to my office manager on the phone, and you had discussed doing the 3 sessions, correct?
Right.
Okay, great. Now, I want to spend a few minutes just talking about your stress management. How would you know if you were successful? How would life be different for you?
Well, first of all, my back probably wouldn't hurt so bad from being all tense all the time.
I have a friend who's a chiropractor. He actually says the majority of people who come to see him for back pain are actually stress management clients.
Right. I believe that. Because I know that if I just get 10 minutes to just sit and relax, it starts going away, and I'm like, oh, that's what it feels like. And then get up and go, and it all comes right back. I probably wouldn't snap at my children so much. And probably I could just be more organized and focused if I wasn't so worried about not being organized and focused.
Sure. Now, a lot of people have stress, and they never come to see a hypnotist to help them. So was there something in the recent past or the last couple of weeks that actually motivated you to make the phone call and schedule an appointment?
I think everything has just kind of been compounded, one thing after another piled on, and those old commercials where the girl just stops and screams, "Calgon, take me away," because she just wants the bubble bath.
Right.
And I had one of those moments, and I need the bubble bath that's going to last, essentially.
Sure. Well, I'm glad you're here. The people who do come here find that the sessions they spend with me are very, very helpful. I don't do long-term therapy, even though I'm licensed as a psychotherapist. I no longer do long-term therapy with somebody. I really view myself as a teacher, and I'm going to teach you the things that you need to know in order to effectively handle stress without the children snapping at the children, without feeling like you're disorganized, and without feeling just that you can't handle life.
Well, and without popping pills and stuff too. I have some other girlfriends that they get stressed out or they get depressed or whatever, and they go get another prescription for something, and that fixes nothing, and I don't want to do that. And that's one of the other things that really drew me to hypnosis was, I guess, there's no drugs, there's no stuff. It's
hypnosis isn't really something I do to you. I'm not going to do anything to you. Hypnosis is something I'm going to do with you. I'm like a coach, and I'm going to guide you through a process that's already within you. Hypnosis isn't magical, it's not mystical. The whole time you'll always be aware of what's going on. But I can promise you 4 things though. Number 1, that hypnosis can help you to feel the sense of being able to handle stress. And number 2, that it really is a technique or a strategy that can help you to problem solve. Like I said, you're always going to remain in control during the entire process. And the other thing that's important to know is this is not therapy. I'm not going to ask you to reveal deep, dark secrets. I'm not going to do psychoanalysis. I'm not going to really try to figure the meaning of things out. Because for most people on a day-to-day basis, it's really not about trying to figure out what yesterday meant. It's about being able to successfully make it through today. And so I'm really glad that you're here. I think you're going to find it to be beneficial. And in this first session, I'm going to spend a little bit of time getting to know you better. I have some paperwork for you to fill out. Every office always has to have paperwork.
Right.
But in answering the questions that are there, it's going to help me to really understand how I can help you to my greatest ability, and you'll find that it's really effective for you. In fact, before we even go any further, just taking a breath. Perfect. Yeah, you've made the right choice by coming here today. And let me just take a minute just to show you what hypnosis is like. I mean, it's about feeling different. And that really is a fairly simple thing. So I noticed when I asked you to take a breath, you took in a deep breath. And so before we actually move over to the comfortable furniture and do a full hypnosis session, just take a minute and close your eyes and scan your body anywhere you're carrying the tension of the day, and
Everywhere.
and let those muscles everywhere relax then. Let your shoulders drop, let your eyelids drop, unclench your jaw. Just taking a breath and exhale. And now count to 5. In your own mind, 1, 2, 3, 4, 5. Now open your eyes. Really, this is what hypnosis feels like. It feels pretty good, doesn't it? But having a place away from the stress of the day to just step back and get a new perspective on things and to find new solutions is going to be a starting point that's really going to help you to solve problems in the long run. I do have some paperwork for you to fill out. The first piece of paper here is called an interview form. There are a lot of questions on here. If there are questions that don't apply to you, just leave them blank. That's okay. The next page here is called a Strength and Resources Inventory. And I just want you to put a check mark by all of those things that you think apply to you. It's really self-explanatory. And then this other one is a little pop quiz. It'll only take you a minute, and it's called an assessment of primary representational systems. It's a long name, but it's really not that fancy. We all have a way of learning. And one way to manage stress more effectively is to learn how to manage stress in a way that's consistent with the way that you learn best. And so that's going to help me figure out, are you good at visualization? Are you good at auditory suggestions and instructions and self-talk? Or are you a kinesthetic person? In other words, do you feel things? Physically, you said back pain. That's one of those physical things that is very kinesthetic. So it'll help me get an idea of what's going on with you. Now, the last form here is a form called Informed Consent. It says that even though I'm licensed as a therapist, I'm not doing any therapy. If you ask me or have a need for a referral to a mental health professional, I'll be more than happy to make a referral for you. But what I provide here is really hypnosis that teaches. It's an educational process to teach you how to more effectively manage stress on a day-by-day basis. So if you'll fill that out, that'd be great. Let me get you a bottle of water so you can go ahead and fill it out. And now, Stephanie told you it was $259 for the 3 sessions, correct?
Correct.
Okay. Are you going to be using check or a credit card or cash?
Credit card.
Okay. If you'll give me that now, I'll get you a receipt while you're filling out the paperwork.
Plastic.
Okay, great. Here you go. Here's your card back. Here's a receipt.
Thank you.
And you finished with all the forms?
Just about.
Okay, great. I got you a bottle of water too. Did you see that?
Wonderful.
Sure. All right. Okay, great. And, you've shared a lot with me, and I see some things that are on here that are useful to me. The one question you didn't answer on here is, what do you do for fun?
I don't know anymore.
Okay.
There's a lot of things I used to do. There's not a lot of time
All right.
lately to do much.
Sure. What did you do in the past for fun?
Read,
Okay.
just a little quiet, alone time.
All right.
I mean, I do fun things with the kids or this or that, but...
But they're not unstressful.
Right.
Sure.
Exactly.
Chuck E. Cheese is fun,
Very stressful.
but it's kind of stressful.
Yeah.
Okay. Great. Do you have any questions for me? I'm more than happy to answer any questions about hypnosis or about our office or really anything.
How long have you been doing hypnosis?
It's really kind of interesting. I learned hypnosis, it was almost 25 years ago when I was in graduate school. My clinical supervisor here in Tulsa, he was a clinical hypnotherapist, a psychologist who taught me during graduate school how to use hypnosis. And so when I finished graduate school, I worked in a variety of different psychiatric settings, and I used hypnosis to varying degrees with different types of groups over the years. But our office has been open here in Tulsa exclusively devoted to hypnosis since 2006. And so since 2006, I've been doing clinical hypnotherapy rather than any other form of psychotherapy. Sure.
Do you use it yourself? Do you do self-hypnosis or have someone else hypnotize you?
A lot of people ask about my experience with hypnosis, and I've used it on a number of different occasions in life. Again, hypnosis isn't something that I do to somebody, it's something that I teach a person. And I've learned to use hypnosis as a problem-solving tool in my life. I used to be afraid to fly. I wouldn't fly anywhere on an airplane, and now I fly all the time. I've flown around the world, and in hypnosis, sometimes it feels like 5 minutes, even though a half hour has gone by. And that experience I've learned to use on airplanes, and I actually really enjoy flying now. It's one of the few places I am without cell phones, without kids, without a dog, and I've learned to overcome my fear of flying and actually look forward to it. So I've used hypnosis for that, and a few years ago I had a foot surgery, and the studies show that if a person learns self-hypnosis before surgery, they have decreased complications, they recover faster, and they need less medication. In fact, you said that was your goal, to avoid the medication that the doctors might give you for stress management.
Right.
And so I took that as an opportunity to practice what I do with my clients. And I found that even though my foot surgery really was pretty complex, I used no medication for pain control, because I was able to really take control over my own body. And stress management is often very physical. In fact, in the book that the psychologists used to understand psychiatric problems, panic disorder, the first 11 things are very physical. A tightness in the chest, sweaty palms, a flushing feeling. And with anxiety or stress, people often have very dramatic physical responses, starting with back pain. And hypnosis is a real useful tool for taking physical control over any stressors that you experience. Any other questions?
I don't think so.
Okay. Well, what we're going to do now is we're going to move over to the more comfortable furniture. And this process really is pretty simple. I'm going to guide you through a process really of deep relaxation. And as you relax, I'm going to give you a number of different suggestions. The suggestions are what we call the things that I'm going to teach you. And you'll find that when we're done, you'll feel wonderful, and that you'll be able to leave this session today and really experience a new manner of living. So, fantastic.